Yep.
Good afternoon. I was about to say good morning. That's what it feels like. Good afternoon, everybody. Thank you for joining us at this week's seminar. We are excited at the Health Department to again be co-hosting the seminar series along with the University of Montana School of Public and Community Health Sciences. I think I should get an award for remembering how to say that. But we today have one of our air quality specialists, Sarah Coefield here, and she is going to talk to us about wildfire smoke mitigation in indoor spaces. So we'll look forward to that presentation. And then for those of you who would like to know, next week, Dr. Rose Zolliger will be joining us. She is the Senior Malaria Technical Advisor to the U.S. President's Malaria Initiative, and she'll be presenting "What Can You Do with a Global Health Degree? Insights into Malaria Prevention and Control in Africa and Asia." But today, please join me in welcoming Sarah for our seminar.
Thank you, Vijay, and thank you all for having me here to talk about wildfire smoke, which is my favorite thing to talk about, as a lot of you already know. But I'm going to be focusing on some research that we did with EPA about wildfire smoke in indoor spaces in Missoula County. And y'all are going to learn about the truly, truly sexy topic of HVAC systems. Little did you know how exciting it can be. So first off, I think a lot of us are already aware that wildfire smoke is a significant public health threat. I think that's becoming pretty common knowledge these days. That wildfire smoke is just a massive issue for huge swaths of the country. You know, it's not only confined to the Mountain West anymore. We're seeing smoke that can actually reach across the United States in a bad year, affecting just tremendous numbers of people. You know, even in a bad fire year, relatively few people are going to lose their homes to a fire in any given community. Now, there are obviously some tragic exceptions to this, but every single person in a community will be affected by that smoke. So what do you do in public health when you have thousands and thousands and thousands of people who are at risk from a fire burning on the hillsides? Now, the stuff that's in wildfire smoke, it's chemicals too. Literally hundreds and hundreds of different chemicals are in it. The volatile organic chemicals are what a lot of people notice at first. They give it kind of that campfire type smell and feeling to it when you're first getting a whiff of wildfire smoke. And there's formaldehyde and benzene. There's polycyclic aromatic hydrocarbons, which are carcinogens, and carbon monoxide, the chemical asphyxiant that is more of a concern if you're right up close to the fire, especially for wildland firefighters doing mop up. But there are some studies showing that carbon monoxide can actually travel some number of miles to nearby communities. So elevated CO levels might be an issue for communities near a wildfire. But the thing we're most concerned about is particulate matter, the teeny tiny particles that are formed during incomplete combustion. When you inhale them, they go very, very deep into your lungs, into your respiratory system, and can actually pass into the bloodstream, setting off an inflammatory response. And it is this inflammatory response that really is linked to a lot of the really severe health effects you see from particulate matter exposure. Now, when people first are exposed to wildfire smoke, what they might notice are the watery eyes, the headaches, kind of irritated throat that's coming from the VOCs in that smoke. But from the particulate matter, you start to see things like worsening frequency and severity of asthma attacks, worsening COPD symptoms. You have decreased immune system function, which leads to worsening response to infectious disease, which we've seen locally with flu, but also a lot with COVID in California. We also see increases frequency and incidence of stroke and heart attack and mortality during and immediately following a wildfire smoke event. So clearly we want to be reducing people's exposure to the smoke as best we can. If you think about who do we really want to make sure we're protecting from the smoke, obviously everyone. You know, smoke's bad for everyone. It's not healthy for a single creature or human that exists, but there are some people who are more at risk than others. Children being a really significant sensitive group. You know, they're still developing. Your lungs don't finish developing until you're an adult, and so having that exposure to the wildfire smoke can have lasting consequences for children who are exposed to it. There are some studies looking at primates that are exposed as infants to wildfire smoke. And they found that as those monkeys grew up, there were lasting effects to their lung stiffness and to their lung function, and even some immune changes that got passed on to their offspring. So it's important that we don't expose those little developing lungs to smoke. There's also been some studies that have shown that during a smoke event, the age group that has the highest increase in hospitalization for asthma related symptoms are those very young children, like ages 0 to 1 and 0 to 4, had like the biggest increase in admissions to the hospital for asthma related symptoms. So very young children and really all kids, and again, everyone, very sensitive to smoke. Anybody with chronic diseases, especially heart and lung disease. And with heart disease, if you have high blood pressure, you're at higher risk. It's all cardiovascular disease. It's not just like, oh, I have massive heart failure going on right now. It's just anybody with any kind of lung and heart disease. But there's also diabetes is another something that is showing as being an issue for people exposed to smoke. So it's really one of those things where like the more you look into wildfire smoke, kind of the worse the news gets for like, okay, now there's another group. Oh, okay, there's another group that's really getting sick. Oh, there's another. It's bad. Obviously, elderly folks are another very high risk category. So right up there with the huge increase in percentage of people going to the hospital for respiratory issues. With young children, you have the elderly for a large sudden influx of people being very affected by the smoke, which isn't surprising because their systems have already been through a lot. And then you're adding this onto it, and pregnant people. And I'm not going to sit here and look at Erin and tell you about pregnant people and wildfire smoke, because I think that she could do probably a better job. But when we're talking about this, it does come to about 30% of the population that we already know is more sensitive to the wildfire smoke than maybe everybody else. That is a huge number of people. We have a little over 100,000 people in Missoula County. That means I have a little over 30,000 people who are off the bat at higher risk from the wildfire smoke. So as a public health professional, like that's a lot. Like that can't be solved with individual interventions. That is a systemic issue. Like how do we treat this, and how do we approach wildfire smoke on a huge scale, and what needs to be done, what needs to be looked at to make sure these tens of thousands of people just in Missoula County have access to safer air debris. So just a quick primer, some numbers to throw at you. Now, because particulate matter is extremely bad, it is regulated by the EPA for at least human-caused pollution. We do have national ambient air quality standards, which is what my job is mostly about, which is the human-caused pollution side of things. And this is looking at the 24-hour average and the annual average. We're not supposed to exceed and still be in attainment with these standards. Now, the 24-hour national ambient air quality standard is currently 35 micrograms per cubic meter of air. This is not super protective. There are a lot of studies showing health impacts below this particular 24-hour standard. Our current annual average is 12. EPA is currently proposing revisions to these standards. Right now, they're only looking at addressing the annual standard, so they would retain that daily at that 35 and maybe bring the annual down to somewhere between 9 and 10. So that's a whole other conversation that I'm willing to have if people have questions about my feelings on this. But that's just something to keep in mind. So I'm going to be using that daily standard to kind of give you a kind of way to gauge what we're seeing when I'm showing you some data. And then also be aware there is no indoor air quality standard. There is no requirement that your air quality inside a building be clean, and not from EPA and not from OSHA. So just kind of keep that in mind if you're thinking, oh, I must have a safe, clean environment in my workplace with low particulate concentrations. No. The OSHA standard for particulate matter is 5,000 micrograms per cubic meter of air. So that is not a useful standard. So there's no requirement that indoor air be clean. So if you want it to be clean, you have to be proactive. So what do you do then when the smoke rolls into town? What steps do you take? Now, you have to prepare. You have to plan for it. You have to have understanding that that smoke is going to come inside. Now, I first started getting interested in this going into the 2017 fire season. And that was when I started working at first with Climate Smart Missoula, looking at intervention strategies and how can we get some programs off the ground to protect people from wildfire smoke. And that happened to coincide with the worst wildfire smoke year we've ever had, where we were surrounded by fires. There was no good direction for the wind to blow. All these fires started in July and they burned until it snowed, which for us, happily, was middle of September because Montana is weird. It works. But it was a very, very, very bad fire season for any of us who were here, still more than a little scarred by the 2017 fire season. But while we were going through this, Climate Smart put some sensors that they borrowed from the university in buildings around town. And the data they got back was really interesting and also, I don't know if depressing is the correct word, but not happy. So the black line is on the big tall black line. That was what we were measuring at our apartment monitoring station in town. The yellow line was, I believe, the old library. The red line was the senior center. The black dotted line going across is that 24-hour standard. The blue line is a fitness center that had MERV 8 filters, and they did pretty okay on this particular day. Didn't do as well some other days. And then the purple line was Amy Sillenberg's house, and Amy, like a lot of us, does not have air conditioning. And so she had to open her windows at night to let the cool, smoky air in. And she closed her windows, turn on her air cleaners with HEPA filters, and had the best air in Missoula inside her home. We saw that the buildings that we would have told people to go to because they have air conditioning did not necessarily have super great air quality inside those buildings. That made us very curious about what that meant and how it could be addressed. So I did throw a term at you might not know, and that's MERV. It stands for Minimum Efficiency Reporting Value. It's a scale that's used to describe the ability of a filter to remove different sizes of particles. So the higher your MERV, the more effective that filter is going to be at taking up smaller particles. What you might have in your home, it could be as low as a MERV 4. And this purpose of this filter is just to keep bug parts and animal fur out of the guts of your HVAC system. That's its main purpose, is to just protect the machinery. The current commercial standard is a MERV 8, and they're fine. They're fine. They are most of the year. That's a good filter. It'll do a good job. It is not designed to remove the tiny, tiny particles and smoke. Because one thing that about the particulate matter 2.5, that's 2.5 microns in diameter and smaller, the particles in wildfire smoke are actually at and smaller fraction. It's frequently much smaller than even 1 micron in diameter. So this is super, super, super tiny stuff. So you don't get to a filter that's designed to remove those really tiny particles until you get to about a MERV 13 or higher. Now the MERV 8 will take some out, just the physics of filters and particles passing through filters. You will see some cleaning with the MERV 8. But you aren't going to get a filter that's actually designed to do that cleaning until you get to a MERV 13. And you do not find these in the wild very often in Montana because a MERV 8 is what is required, and so that is what people have. We have found even LEED Platinum certified buildings, and part of how you get that LEED Platinum is having a MERV 13 filter. They pulled out those MERV 13s as soon as they could and put in MERV 8s because they're cheaper. So that is something that we have found locally when we're trying to find people using these better filters. It was a real struggle trying to find anybody who was actually just using better filters in their HVAC systems. So I want to really quick talk about homes, because I think that it is probably much easier to clean the air quality in a home than in a commercial building. But there are obviously barriers here when it comes to things like substandard housing and the fact that there is still a cost associated with any of this. And then if you don't have any air conditioning, there's also the issue of you have to let the cool air inside because heat will kill you faster than the smoke for most people. And so this is not all inclusive, but in general, if you have the means and the home you can do it in, you can create a clean room in your home really effectively with portable air cleaners with HEPA filters. If you have an HVAC system, even just a furnace fan, you can put in a good high rated filter for that furnace and run all your air through that furnace filter and clean the air inside your home pretty dang fast. Benchbit did that. My coworker handled purple air. He just put in a MERV 11 filter in his furnace and like poof, cleaner air inside his home. But every time he opened the door to the dog in and out, it got dirty again. So you have to keep that in mind that you're like constantly have to be running that. If you turn it off, you turn off that fan, you stop circulating that air, you're stopping your air cleaning. One quick thing, if you want to run your air conditioning, central air conditioning with a better filter, you need to do some investigation first and make sure your system can handle it. Because if you put in a much better filter, there is going to be some resistance. You're going to see reduced airflow across the coils of your air conditioner, and that can cause it to ice up. So some air conditioning units are totally able to adjust that airflow and tell, okay, I need to like crank through how much more air is coming and really push it to keep those coils appropriately, well, reduce the pressure drop, like keep the amount of air going across the coils, keep them from icing up. But some older systems might not be able to. So if you have a system where you cannot have a better filter and run your air conditioner, use portable air cleaners. If you don't care about having air conditioning at all, just turn off the air conditioning, just run the fan on recirculate and clean your air. Now, portable air cleaners themselves, they're a fan and a filter. Like you can spend a lot of money if you really want on an air cleaner. You can get lights and remotes and it can probably sing you a song, I don't know. But if you're paying for bells and whistles, all it is a really good filter and a fan. So when you are looking at purchasing one of these, you want to make sure it's sized appropriately for the room that it's in. It needs to be able to change that air multiple times in an hour to really get you good, effective cleaning. You want to investigate how loud is it going to be cranked all the way up, and what is the cost of this for its lifespan, because you're going to be buying replacement filters. And if you get the company's branded filters, they can be very expensive. And you're going to be needing to replace it potentially multiple times in a really bad fire season. So you need to investigate how much is it going to cost to replace these filters and plan for that when you're making a purchase decision. Like I see people buy really nice air cleaners that are like a great sale. I'm like, those filters are going to cost you $100 each for the rest of your life. So do some due diligence, do some investigating. Climate Smart Missoula has some recommendations on the Montana Wildfire Smoke.org website for advice for picking out a good air cleaner. Now, like I said, this is a fan and a filter. So if you've got a fan and a filter, you can make your own air cleaner. Is actually quite effective. Get a newer box fan and a good furnace filter, smack them together, and you can just get yourself an air cleaner. There's a lot of different configurations you can do with the filters. You can make a cube out of them. Some folks designed a cube of filters and named it after themselves. So you can build yourself a Corsi Rosenthal box if you want. I mean, good for them. It's all over the news. You can make a Corsi Rosenthal box out of furnace filters. Pro tip, if you want to buy furnace filters, get them online in bulk, and that'll bring the cost per furnace filter way, 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 way down. If you go to a hardware store, it costs you $20, $30 for a good furnace filter. If you buy them in bulk, I've gotten it down to $8 or $9. So go in with some friends and get yourselves some cheaper furnace filters. You do want to make sure that this is built after the box fan was manufactured after 2011, because up until that point, they sometimes caught on fire, which really undercut their effectiveness as an air cleaner in a smoke event. But now they have great safety features. This contraption has been tested by Underwriter Laboratories and certified as safe and good to use. And then our engineering friend here locally, Tom Javins, who used to be the facility director for the university, we tasked him with trying to set one of these on fire. He tried really hard. He tried so hard. So I think engineers, if you say, set this on fire, like they're going to take that challenge and run with it. And he was unable to get one of these to catch on fire. So a much less expensive way to clean your room, an air in a room. Just keep in mind that's going to be louder than the other version, and it does generate some heat. So if it's really hot outside and you don't have a source of air conditioning, this will put some heat into your room. So keep that in mind. Okay, so I've said this briefly already, but commercial HVAC systems, why do I think that they're harder to use to create clean indoor air? It's because the job of a commercial HVAC system is to take outside air and bring it inside. That is literally what it does all day. Like it's just bringing outside air, bring it inside. It does this for a couple of reasons. It does it to moderate temperatures, especially if it's cooler outside than inside. It's going to bring in that cooler air, so it doesn't have to exert the energy required to cool the air itself. And it's to ventilate an area. We create a lot of air pollution ourselves. Humans are kind of filthy creatures. So it's getting rid of carbon dioxide, it's getting rid of all the pollution we're generating ourselves, and germs and viruses and everything else. You want to flush that out. And so a commercial HVAC system is just bringing in outside air, taking out inside air, and going through this. The filters, like I mentioned, the standard for filters is really more about protecting the machinery than the people inside a building. And what we have at least found from our own experience with this research is if the temperature seems okay, you aren't really thinking about your HVAC system. So when was the last time you really explored it to see if all of the parts are moving how they're supposed to move? And how the parts move, and if they can move properly, all affects what happens to indoor air quality. So we found some things, you guys. So really quick schematic. I'm not an HVAC mechanic or engineer. I've just made Tom Javins tell me lots of things. But just really quickly, outside air is brought in, goes through a filter to protect some machinery. The economizer determines like how much outside air is brought in. So when it's summer and they're trying to cool down the inside of a building at night, that'll be wide open just to bring in outside air and cool down the building, like bring in as much cold air as possible to save on cooling costs. The return air comes up and it can be recirculated back into the building, which can be done to save on heating costs. In the winter, if you don't want to be reheating everything, just kind of keep rotating your warm air through the system, or it can be vented back out. And so there's always a balance of like how much building air is being recirculated and how much of it is being vented out. And then there are filters for the machinery as well. So there's like constantly air movement, but there's always going to be that air coming in from outside for these commercial HVAC systems. You can turn that off, but you also have to work on maintaining your positive pressure in your building, which you can't do if you aren't bringing in any outside air, really. And then you need to make sure you're flushing out carbon dioxide, because carbon dioxide buildup is also very bad inside buildings. And so we have to balance all of these things out. So some years ago, EPA reached out to me and asked me if there was something I would be interested in doing with partnering with them on a research project. And I told them about our experience in 2017 and about what we saw in the buildings, the commercial that Climate Smart put sensors into. And I wanted to really dig into how good is the advice to tell people to go indoors in like a library or go exercise inside, or how safe are classrooms and schools really, and is it actually, are we being adequately protective in these public spaces? I know they have air conditioning, but do they also have clean air? So we put purple air sensors inside and outside multiple buildings around Missoula County in 2019 and 2020. We tried to target buildings that people would be in, some fitness centers, childcare, churches, libraries, museums, office buildings, and just trying kind of a variety of places people might be spending their time during a smoke event. And we also in 2020 put in door counters in some of the buildings to see how that kind of like movement of people in and out of a building was affecting the concentrations that we were observing. And then Tom Javins went around and inspected all of our buildings to really kind of tell the story for us to understand why we were seeing what we were seeing. So he went through like what filters are in use, how well is HVAC system maintained, are there gaps in the building envelope, is the building, does it have positive pressure, does it have negative pressure, and just really kind of helping us understand that. And the building inspections turned out to be some of the most important information that we gained. So in 2019, we did not have any smoke. It was a total bust. It was a gorgeous, gorgeous summer. I hope you all enjoyed it. I was just like so frustrated. I was so frustrated because we'd done all this work, setting up the study, and then we had just like crystal clear air. But 2020, we did have a week of smoke that came in, and we had pretty much solidly unhealthy air quality for several days. It was super gross, and I was really happy only because of this. But it was really nice to know we were going to get good data to understand what was happening. So that chart down there is just what our concentrations were during that smoke week. And now this is a very, very busy graph. I'm going to walk you through it. We're going to take some time on this. So these are the results for the percent particulate matter reduction inside versus outside. So the higher that bar graph, the better the air quality inside was compared to outside. The gray is showing percent reduction when there wasn't any smoke around. And then the blue is just an average of percent reduction when smoke is present. And the red was the smoke reduction when the building was occupied. So during occupied hours, what was the average percent reduction of particulate matter inside versus outside? So a few things you can kind of see off the bat here is it really varied from building to building. Sometimes when the smoke was present and people were present, the air got better. Sometimes when smoke is present and people were present, the air got a lot worse. And so there were some interesting things that we found that explain some of this. Another thing that we saw was even within the same building, you would see very different concentrations and smoke reduction inside the same building. So here we have a building that had a fitness center and a childcare area. And the childcare, it wasn't great. I mean, you guys can see the worst we saw was a 20% reduction. So everywhere did have better air quality. Everywhere had better air quality than outside, but going to a 20% improvement, that's not a lot. And to the very best we saw was about a 50% to 60% improvement, which is still not amazing, because if you have 100 micrograms outside and you cut it by 60, you down to 40 micrograms, are still unhealthy for sensitive groups. So not great. But even with the same building, we would see very different situations. So in the childcare versus fitness center, sometimes the fitness center had the same concentrations as outside. So you pretty much might as well have been outside. We saw in an office building, which is health department, from floor to floor, very different air quality. And then that school, which is a brand spanking new school, so even a brand new school, which had promised me that had more 13 filters, they didn't. They had better than most other places because it's a brand new system, so therefore in good shape. And also really varying percent reductions from location to location within that school. We also found out that we really thought that the filter rating would be one of the most important things for the indoor air quality, and it really wasn't. Because like I said, most of the places we looked all had MERV filters. We had a really hard time finding anyone who didn't. And there's huge variation among those MERV filters. And then even the locations that had better filters, so the hotel had MERV 11s, they didn't do any better than anyone else. And then that office building, they had a MERV 14, and I'm going to talk about them more in detail later. And they did do better than a lot of other places with their MERV 14 filters, but not by a lot. So it just made us understand, okay, there's a lot more going on here, which is why those building inspections come into play and being very important. And then the church there that had no HVAC system, kind of our control type of thing we're looking at. You can see there's still some improvement, and some places that had filters were not much better than the church that had nothing. So that was really an important thing to see that, okay, there's more going on here than just if you have an HVAC system or don't have an HVAC system. We also saw in some places when smoke was present, the percent reduction improved, and that could be that maybe the occupants were taking steps to reduce door openings or window openings or doing something to kind of try to mitigate the impacts. Now the office building with a MERV 14, they actually have a whole protocol around wildfire smoke we'll talk about in a little bit. So here we are, we're going to pick on the health department. So differences that we see from floor to floor were really interesting because the outside line, again, that dark blue, navy blue kind of showing what the outer concentrations were. You can see the purple line, which was the first floor, and they had stable air quality, occasionally tipped up into unhealthy, but mostly was in like moderate to unhealthy percents of groups territory. The second floor, we were up into unhealthy concentrations quite a bit and had this huge fluctuation in concentrations like throughout the day, very big diurnal pattern. That when we looked at it, using the door counters and looking at the timing of everything, you can see the dotted red line going down vertically on that chart are the open hours of the health department. And the solid lines are the air quality percent reductions on the second floor. So as those lines plummet, air quality is getting worse. on the second floor. And you can see it starts to get worse before the building opens. So it's not because people are coming in and out, it's because the HVAC system turned on. So the HVAC system turned on and started bringing in dirty air to the second floor of the health department before people were even present. And then we were running portable air cleaners because we knew that we had that indoor air quality already going. We've been running air cleaners for years in the health department. And I kind of think it's very possible that the reason it got better overnight is because the HVAC system clicked off and those air cleaners had a chance to recirculate the air and clean it. But during the smoke event, if that HVAC system was bringing the outside air inside and it's not going through a good system, you're just dumping smoke and you kind of feel like Sisyphus. You're just constantly getting smoky air coming inside. Now, the good news, we are getting an HVAC system. I believe that's still in the works. So it's going to be okay. So that's why I feel okay picking on us right now. This was an interesting one looking at the church that had no HVAC system at all. And you can see their indoor air quality unhealthy all week, which is not surprising. So the only way to cool the church was to just bring in unfiltered air, opening windows. But also they had these weird spikes on their data. And so we had folks go in and investigate what was going on at the church, and it's incense and it's candles and it's sources of air pollution that they were making themselves that were hitting wildfire smoke concentrations. That turquoise line, that spike, was way before we had that kind of outdoor smoke. So that's something to kind of keep in mind is we create a lot of our own indoor air pollution, not just in churches. It's if you burn candles at home, if you cook on your stovetop and it's not in the back with a ventilated hood, taking it outside, making Brussels sprouts will smoke at your house. There's all kinds of things that we do that create our own air pollution. So if you want to be like me, you have air cleaners running all the time, or else just make sure you're ventilating your home as best you can, because we make a lot of our own air pollution. So keep in mind that even if it's not smoky outside, your indoor environment may be polluted. So there's steps you should be taking to keep that environment as safe as possible. And then here is a community center that also we saw they struggled a lot, had concentrations of unhealthy percentage groups into unhealthy throughout the smoke week. And again, like the health department, it got a lot worse when it was occupied. So while that building had people in it was when it had the worst air quality. And that is a situation when it had a commercial kitchen that created negative pressure that would pull smoke from outside inside, because when you have negative pressure, you're kind of pulling air from the building and pushing it outside. They also, though, had not very well functioning HVAC system. They were rocking a MERV 5 in one of their HVACs, and their filters themselves weren't in really great shape. And so yeah, that's right. And they had a broken air damper, which meant they couldn't stop the smoke from coming inside. And so that building, when their HVAC system was running and people were in it, had worse air than it did when it was closed. So that was unfortunate thing to see. So this is the example of the office building that has a building manager who is very, very anxious and desires very much to keep his building occupants safe. This is a huge office building, many, many people there, and they have a lot of rooftop units. But when it's wildfire season and smoke is starting to come, he has on his computer thing like the big red wildfire smoke button that he hits. He's shown it to me. And it limits all the outdoor air intake into the one unit that has a MERV 14 filter. So he's only pulling air in through that MERV 14 filter. He also has like a 2-inch carbon filter to try to pull out the VOCs. So he's pulling in air through filters and then it's recirculating the building air through the MERV 8s for the rest of the day. So he's really limiting his outdoor air intake to avoid pulling in more smoke and trying to bring it through a good filter. And you can see like he did better than most anything we've looked at here. It was generally in the moderate. It's not good. Did not get good, but it was at least moderate. It was better. And this is a building that again has like a zillion employees. I think they're open 24 hours, coming in and out. So it's not too surprising that maybe be seeing some impact from just constant door opening. But some recommendations that were passed on to him were like, hey, recirculate your indoor air through MERV 14s as well, to try to continue that cleaning. Because the more times your air goes through the filter, the cleaner it gets. Like a single pass is really sufficient to really get you that clean air. You want to recirculate that air through the filter as many times as possible. So things that are affecting the indoor air quality, the type of filter does matter. Like it is better to have a better filter if you can, but you also want to recirculate air through that better filter. You want to make sure that the filter is fitting in the system correctly. You want to reduce the amount of air you're taking in inside when it's really smoky outside. You want to reduce the amount of outside air you're bringing in as best you can. And then pay attention to if your HVAC system is functioning correctly. I know it's not very exciting to inspect your HVAC system, but we need people to be doing that, be paying attention to it. Just some quick show and tell. We have here a damper that is broken open. So the temperature moderation might be going great inside the building, but the damper can't close. So there's no way to prevent outdoor air from coming in, even if you wanted to. So say these folks wanted to cut down the amount of outside air they're bringing in, they can't, it's broken. We saw some very, very heavily used filters. I kind of think probably loaded one might actually be from here. One of the first ones you saw was from the university, you guys. But a heavily loaded filter is an issue because air can't go through a loaded filter, it'll go around it. You know, one thing that I like to say is, you know, air is like life, it will find a way. And so if your filter is super loaded, the air is just going to go around it. We also found filters that's jammed in there, like, oh, this will fit. And if you have a jammed in filter, it's all wavy and there's like gaps in it, the air's going to go through the gaps. It's going to take the easy way. It's lazy. It's not going to go be following the directions you want it to follow. So if you have a filter that doesn't fit where it's supposed to go, you aren't doing yourself any favors. So you want to make sure it's clean. You want to make sure it fits right. I guess that's it for that slide. And then you also want to do a quick look and see, well, how leaky is my building? Are there places where outside air is going to come inside? And you also want to look at if you have maintained a positive or negative pressure in your building. If you have good filters, you know, like you have really good filters in your HVAC system, they maintain positive building pressure, then door openings won't affect your indoor air quality because the positive air pressure is going to be pushing that air out, and outside air is not going to be able to come in because you have positive pressure kind of pushing against it. But you want to make sure you have good filters. You're actually having really good filtered air coming into your building to make that worthwhile. But we did see in our study lots of gaps in building envelopes and seals that were having issues. You also want to make sure that you aren't blocking parts of your HVAC system. So here's a return air vent that has got a file cabinet pushed up against it. So that's not going to help the building maintain its pressure at all, because you need to maintain it's a whole ecosystem is the correct word, but it's circulatory system maybe, where it's just like it's supposed to flow, like the air is supposed to flow, like there's a route it's supposed to be taking, and blocking off return air vents is not a good idea. Again, here's another crushed filter, and then more dirty filters. So just, I know it's not sexy. I know no one thinks like, gosh, I wonder how my HVAC system looks, but it has a huge impact on your indoor environment. And we spend most of our time inside, and during a smoke event, we're spending almost all of our time inside. So we should be taking some steps to make sure that it's clean. Some additional things you can do, you can use portable air cleaners to kind of create a room by room thing, like we saw at Health Department though. If you are dumping dirty air constantly into those rooms, you might not get as clean as you would if you were not dumping dirty air into that room, because for a portable air cleaner to be super effective, it needs to recirculate all that air multiple times an hour. So it needs to be able to, you know, have air to recirculate that isn't constantly being refreshed with dirty air. You can also use an air quality sensor to see what's happening in your environment. These are ranged in from pretty low end to kind of more hoity-toity expensive for the consumers. They are not always super accurate, which I think a lot of us are pretty familiar with, but they are precise. So if you get yourself an air sensor and you see what it says when you know the air is good, like in the spring, open your windows and kind of see, like, what does it say is really good air? If it says it's getting worse during the fire season, it's getting worse. You can trust that and see what measures you can do, like play around with it. What can I do to improve that, get us back closer to that better air quality? So that's just a way to kind of pay attention to your environment. Now we did let everybody in our study know how they did. EPA put together these great big documents for each individual building with recommendations for every building based on the studies that we saw. So here's what I've been telling you. We have relayed to the participants in our study so they can make changes, hopefully, to improve their building environments. And then some cool things that are coming out of this is ASHRAE, which is an organization that sets standards for HVAC systems. They came out in 2021 with a framework for buildings in wildfire smoke prone areas to help them understand all of this, to take steps, be proactive, and prepare for wildfire season. It's very practical things. It's not even like a super huge long detailed thing. But you know, make sure your HVAC functions. Like make sure your dampers all close. Look for broken parts. Put in filters that are clean and fit correctly, and plan ahead and have enough on hand, and maintain your positive pressure. So all those things like that's in there. And then they are finishing up an official guideline. It's not a standard, but it's a guideline that's going to be very hefty. Has had a lot of great minds working on it for a couple of years now, for buildings to follow to protect their occupants during wildfire smoke events. That is undergoing internal review right now. Should hopefully be out pretty soon. And I'm really excited about it. I'm excited about all of these things because for a long time now, I've just been like putting advice as a person who's read things on the internet and talked to engineers. But now it's gonna be like, this is what ASHRAE says. Do what ASHRAE says, and it's gonna have way more weight. So I'm very excited for this. EPA has been really getting more interested, invested in the indoor environment during smoke events. So they have some great resources online. And the Wildfire Smoke Guide for Public Health Officials is actually a really great document. And they also go into some good details. So we had a pretty good sized team working on this at the Health Department. We did most of the field work. EPA did so much data analysis. They were great. And yeah, so I'm happy to answer any questions or talk more about this stuff if you guys want. Yes,
So I guess rolling on the air filters, the HEPA filter systems. You mentioned, you know, more expensive. You're probably just paying for bells and whistles. Is that true for folks who might be interested in doing indoor air quality monitor, like a 0.5 monitor? Is it true that it's more expensive is better? It's going to do more, or is it sort of the bells and whistles also? Have you found in your experience?
You know, I only have experience with purple airs. I'd probably let Tony or Curtis take that one on more. I just, you know, from the studies that have been done looking at the lower cost sensors, none of them are amazing, but some are better than others. And yeah, but I can't really tell you if the monetary point is super meaningful unless these guys know.
Well, I was just gonna, I mean, I agree. I think my understanding is that all of them use the same chip that's manufactured in China as the actual sensor. So I think if you're looking to purchase one, you want one that's easily accessible and easily usable, so you can look and see what the number is, with the caveat that Sarah already indicated that, you know, it might not be a true number per EPA or Missoula Air Quality Division, but you know,
Yeah,
it'll say something.
It'll tell you something. And then just for our study, EPA calibrated the crap out of our purple air sensors. Like they were up for calibration for a very long time, and each one had an individual correction calculation for that sensor based on the data that they were seeing during our calibration period, so we could actually compare it to real numbers. But for your average out-of-box consumer, yeah, I would very rarely trust a purple air out of the box to tell you real numbers, but it'll tell you trends. It'll tell you trends really well.
Tony's team has used some like personal air monitors that are pretty cheap. And what's been your experience with those?
And they have little lights on them too. So it's, even though you can't see like the digital readouts of their quality, there's like a light that corresponds with it. If it's good air quality, it's blue or green. And then as it gets worse, it goes from yellow to orange to purple. So those work really great. I think it was like $50 or something like that for air sampler.
Yeah.
And you could wear them, so you could, not only just put them in the building, but you could also wear them and go wherever and look at your quality.
I will say that the ones that are on the air cleaners, you might get one that has one on the air cleaner, those are pretty bad.
I was just gonna ask you that, Sarah. I'm glad you're touching on that.
They are not great. They're really good if someone walks by and toots, like it'll pick that up. But like it's not, they're not as great at catching the particulate that we're really interested in. Like if it goes red, then yeah, that's definitely some bad air quality. But I found that it turns back to blue earlier than I would feel super comfortable with when I've run, because I, like many of you, am a nerd and have purple air sensors that I run in my house to kind of see what happens when I change different things. And I have found like it'll turn, say the air is better way before it looks like it's getting better on my purple air that I have inside. So, yeah.
For my personal home systems like with the DIY method you mentioned. If you're setting up like a 2-window, you get like a stream of air circulating through a house, would you put filters on like the exhaust direction as well?
I don't, if you can really maintain the pressure, I don't know that I'd bother with that because you're filtering the air going outside. But if you have any chance that outside air coming back inside, then you would definitely want to have some sort of filtration on that. There's not a lot of work that's been done looking at setting up a fan with a filter on it to bring in outside air being filtered, but the work that has been done on it looks like it does work to an extent. So if you need to cool down your house at night, but you don't want to only bring in smoke, you can put a filter. And you want to make sure it's obviously kind of smoke can't go around it. And reduce the amount of air that's coming inside. But putting that filter on the box does reduce the ability of that fan to pull in outside air. So you're going to get a whole lot as much cooling as you would without the filter on the fan, because it just like reduces the amount of air it can pull through. That's one thing that Tom James did for us.
Sarah, what about like window AC units?
Mhm.
Have you seen anybody experiment with putting good filters on those?
I looked into that when I was first really learning about all of these things. They don't really make good filters for window air conditioning units. Like if you've ever like gone in the bowels of yours, the filter that's in there is just to keep bugs out of it. You can wash it. If you can wash a filter, that's not a good filter. And they don't really make purpose-built really good filters for those AC units. I did see things kind of about like an aftermarket thing, but my kind of sketchy. And I mean, the issue you really want to think about the coils and the airflow. It is mostly just pulling air from outside going over the coils, and then the air on the inside just like recirculates through the machine. So you aren't really pulling outside air inside at all through that window air conditioner unless it's set up really janky, or like I had one once I could actually see the light through the middle. I'm like, oh, but window AC is better than no AC. And like, yes, you can do all kinds of things. So I, a couple of years ago, I don't have air conditioning, but I had a window air conditioner with a super, super janky setup because it's what I had. There was a side sliding window with a very tippy window AC sitting on it that I used a counterweight, which was duffel bag with hand weights in it to kind of keep it from falling out. And just like a piece of plexiglass over it so I could see out of it. And then I had all of my downstairs windows open, screen door open to cool down the rest of the house. And I have cats, so I had my bedroom door cracked because I didn't want to listen to the song of other people all night. And so the door was cracked open a little bit, and I had 2 or 3 of my air cleaners, and they're just going on turbo. It was very loud. It was very loud air conditioner, all my air cleaners, but pretty good in my bedroom. So even with the rest of my house open and the door cracked, with enough air cleaners going, it was much better in my bedroom than it was downstairs. So that's why it's fun to play with these things and kind of see different things, but it was very loud. I'm going to recommend, but it was interesting.
Thanks so much, Sarah. I was a little bit curious. You mentioned that behavior impacted infiltration, and with a study like this with so much variability in buildings and what people are going there for. How did you guys measure that or survey that?
It's more of an assumption.
Okay.
It's like, what else could have been going on here?
Yeah.
Like one of the buildings propped their door open, like you're just making it worse. So people, don't always behavior is just interesting. I'm not a social scientist, but I definitely, I think it does impact what happens. Like one of the buildings that did really, really poorly, they're the ones who propped open their door. So, because they were tired of people like making noise coming out. I don't know what they were thinking, but people are interesting.
Yeah, this is a really interesting. I'm a grad student studying in fire ecology, so thinking more about like, the fire side of things, but it's interesting to hear that the social, super important stuff. I'm curious, how much discussion or communication do you have with like the Forest Service or folks who are maybe making decisions about when to let fires burn or put them out? And sort of like not that we can control it completely, but people who maybe have like a hand in how much smoke is being created.
They're aware. It does not factor into their decision making. They've said that quite clearly, that the smoke impacts are not their primary concern when they're making decisions on the fire. I do know that in Oregon, the Forest Service got an NOV last year from the air agency out there because they were so mad about how terrible the air was in Oak Ridge, Oregon. They were busing people out to get them breaks from the smoke. They were just like busing them out of the valley because they was like relaying that the virus was going forever. And it's one of those things I'd be really curious to see any really thought put into. I'm not a firefighter. I can't make those safety decisions for the firefighters. But right now, the trend tends to be, unless a community is immediately threatened, a pretty large box around the fire that's mostly for firefighter safety. It's because they're like, where can they defend and be successful? But those very, very large boxes where the fire can spread and go until it snows is where you get things like the Lolo Peak fire in 2017, where the box around that fire was really, really, really big. That fire started, it was small on Lolo Peak. And it got enormous and was very, 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 very bad for those of us near that fire for a very long time. In Rice Ridge fire, they tried really hard to put the Rice Ridge fire out, but it escaped their containment, got insane. But that was when goes in the wilderness, you can't stop that, let it go. And so we had really, really, really bad smoke. So smoke has not entered that conversation, other than they're aware, but it is not a deciding factor. I was in a meeting a month or two ago where that was pretty clearly conveyed. The goal is for people to be ready for smoke, which there's things we could do to be more ready.
Tony, I noticed there's a chat. Is there a question here?
That's me asking if there's any questions.
Well, on that delightful note, we are 3 minutes after, so thank
sorry.
you, Sarah. Yeah, thank you for all the great information.
Interventions.
I don't think there's any.
Yeah, there's
Let it go.
okay, I was wondering.
Yeah.
Yeah, I've always wondered about. Yeah. But it's okay, nice to see you. Yeah, there's all kinds of. Yeah, absolutely, this, yeah, that's the ingredients. Oh, yeah, I know. Yeah, I know. See you later. I don't.
Good question.
Hi, Erin.
So-
Um,
Go back. Yeah, it was actually, I don't think I got my calendar. It was the day that you and Ellen and I met last time.